There is a difference. And one of the big things that I tell my female patients is it has to do with the evaluation that you're getting for your coronary or your heart health. With men, blockages do tend to occur in the larger vessels called the epicardials, which is what we think of. That's where we go put stents in. For females, a lot of times the blockage or decreased blood flow can be in the smaller vessels, which is called the microvascular circulation. One of the big things that females need to know to advocate for themselves is that if you go see a different cardiologist and they do an angiogram and they tell you, oh no, no blockages, vessels look great, what they're actually telling you is that your epicardial or large blood vessels look good, and they may need to further evaluate the small, the microvascular vessels. And the treatment for that's a lot different than the treatment for the big blood vessels. Hormones do play a big factor, and it really has to do around menopause. When women are premenopausal, they have higher estrogen levels, which is cardioprotective. So they have lower risks of MIs or heart attacks while they're having higher estrogen levels. Postmenopausal, however, it does tend to equal out with male levels of heart attacks. So one of the big things when it comes to heart disease with men and women is also presenting factors. So men typically do present with those classic substernal chest pressure, you know, kind of the elephant on the chest symptoms that we think of, whereas women's presenting anginal equivalents can be a lot different. A lot of the times it can be nausea, it can be more indigestion type symptoms. Realistically, if you're exerting yourself, you're up moving around, and all of a sudden you're feeling more nauseous, that could be heart related. It's just going to present a little bit different in men as it can in women. So men are at more increased risk for traditional heart attacks. So traditional blockages and large blood vessels. And that, like we talked about, is because they don't have that period of protection for estrogen that women do have. So they are more susceptible to heart attacks, more susceptible to strokes, and definitely in younger stages of life as well.